Anybody needs to go over the heart? Okay, so coming in, this is what?
Pulmonary trunk. Are they inferior?
No.
Superior vena cava.
Superior vena cava. So coming in would be the two what?
Subclavian or
veins.
Brachiocephalic veins. Okay, coming in. Okay.
Brachiocephalic vein.
So this is the right atrium with the auricle, right ventricle. Okay. So coming in, and this would have pectinate muscles. Mm-hmm. Most of the pectinate muscles are in the right atrium. There's some in the left auricle, but mostly in the right atrium.
Isn't there some in the right auricle too? Like I think it said in the book, it's like both auricles.
Maybe, I'm not sure, but definitely a lot in the wall here. And you can also see what?
An AC node, something node.
John, just listen. SA node.
SA node, sino-atrial node. This would be the atrioventricular node. This is the fossa ovalis, opening for the inferior vena cava. And this is the opening for the
the coronary sinus.
Coronary sinus, okay? This is interatrial septum. Leaving the right atrium, we go through the tricuspid, also known as the right AV valve. It's held in place when the muscles contract here by the chordae tendineae and papillary muscles. These muscular ridges, though, are called trabecular carneae. Blood leaves through the pulmonary trunk. So this is an artery carrying the oxygenated blood because it's going to the pulmonary circuit. It then branches into the right and left pulmonary arteries. This is called the ligamentum arteriosum. This is a remnant of the ductus arteriosus. The blood picks up oxygen, gets rid of carbon dioxide, comes back to the left side of the heart through the four pulmonary veins carrying oxygenated blood. So here is the left atrium. You can see where the pulmonary veins come in. Goes through what valve? Bicuspid or mitral or left AV valve. And this is, I think, shown incorrectly here. It makes it look like it's a tricuspid. Blood then leaves the left ventricle through the aortic semilunar valve. Notice the trabecular carneae are larger on this side than this side. And the first branches off the aorta are the
first coronary artery.
The first are the coronary arteries, right and left. Then at the aortic arch, the first one is the brachiocephalic trunk, left common carotid, and left subclavian. This is the aortic arch, and then we go down, descending aorta with the thoracic aorta above the diaphragm, abdominal aorta below. And the foramen ovale is what we call the fossa ovalis in the fetus, and it disappears, becomes a fossa ovalis. This was the ductus arteriosus, becomes the ligamentum arteriosum. For the membranes around the heart, the outermost membrane is coming from the outside would be the fibrous pericardium. Fibrous pericardium. Then fused to it on the inside would be the parietal layer of the serous pericardium. On top of the heart would be the visceral. Remember, the heart is a viscera. Okay, visceral pericardium, or also called the epicardium. Lining the inside of the heart would be the endocardium, and also the valves lining the vessels. And the thickest part would be the myocardium, where you have gap junctions and tight junctions and desmosomes. Now, as far as vessels go, this is the right coronary artery. This is the marginal branch. This is the posterior interventricular branch, feeding both ventricles. Nope.
Anterior.
This is the left coronary artery. It becomes the circumflex, feeding both sides here. And the left anterior descending, also known as the anterior interventricular, also called by some people the widowmaker. The great cardiac vein drains this area. The small cardiac vein drains this area, and the middle cardiac vein drains this. Okay? and they all empty into the coronary sinus. Sinus being a blood vessel that has no muscle in its wall, so it doesn't change size. This is the apex, the pointy part, where the vessels come in and out, would be the base. Okay?